Dr. Selina, could you give us a quick introduction on who you are, what you do as a foot and ankle specialist?
Sure. So I'm Dr. Selina. I am the owner of Final Kick Ankle and Foot Clinic. So the clinic is located in Murray, Utah, and we're coming up on our 2-year anniversary in September. I also have a satellite clinic in Moab, which I go to twice a month, which is fabulous. So I've been practicing for several years now. I did my residency and fellowship here in Salt Lake, and I specialize in all things foot and ankle. So I treat a lot of athletes, both conservatively and if need be, surgically. I also love to run. I've run the Mount Nebo half, I think it was 2 or 3 years ago. It was a massive PR at the time, and I really loved it. So that got me into more half marathons that were down canyons, which was great. And currently I'm training to run a fast mile. So that's kind of summarizing the last few years of my life.
Awesome. Okay, I'm going to be over here watching for your comments and questions during the video. We'll pass those on, and we'll let you answer them as we go.
Yeah, any foot or ankle related questions, if you have a nagging injury, I'm here. Just fire away, and I'll try to answer and diagnose you as best as possible.
Awesome. To start off, we want to give a shout out to Miles and Gavin for already commenting on the video. Gavin says thank you so much for doing this on Facebook so he can tune in from where he is. I was going to start with a question as we wait for some people to comment on Facebook. I've worked in a lot of running stores, and one of the most common injuries that I hear about with the foot and that people come in and talk about is plantar fasciitis.
Oh, yes.
So if someone were to come into your clinic and tell you they had plantar fasciitis, what would your questions be? What would be kind of the procedure you'd go through with them?
Sure. So the first question is, where is your pain located? So a lot of patients come in believing they have plantar fasciitis and their pain's at their big toe or their Achilles tendon. So I have to first make sure that the pain is localized to the bottom of their heel, the plantar medial aspect of the heel. It can be centrally as well, it can be on the outside, but it has to be in the bottom of the heel area. So once we figure out it's not a bone problem, we have narrowed it down to be plantar fasciitis, we do a few other things. So I watch them walk, I check out their gastroc and soleus tension, and then we start talking about treatment. So first line treatment is typically stretching. If they have a tight gastroc soleus, that's connecting to their Achilles, it's funneling through into the plantar fascia. So if all that's tight, they should be stretching out their calves. Another thing I do is, I talk to them about foot strengthening. So a concept called doming, where you're strengthening the muscles in the arch of your foot, as well as the muscles that help your big toe flex down. Another thing is just toe yoga, which isolates a lot of muscles in your foot and gets those stronger. So those are, just generalized things that can help strengthen your foot. Most patients are coming into me and they've had months or weeks of pain, and they just want to get back to healthy running. So I always offer them a cortisone injection. And I know a lot of athletes think cortisone is scary, and it's not indicated for tendons or muscles, etc. But for the plantar fascia, it's very safe. I've probably injected thousands over the years, and patients do remarkably well. So they have relief within days. And then there's stem cells and PRP as well. Those are regenerative techniques. Another thing I offer is shockwave therapy, and that just helps induce blood flow, tissue remodeling, and healing. So a number of conservative treatments. Plantar fascia surgery is super rare. I think I've done like 5 in the last 4 years of my life, which is very low. Everybody gets better with either an injection or shockwave, and then just maintaining everything with stretching and foot strengthening.
So you said that with the plantar fasciitis, you have to make sure it's not like a bone problem.
Yeah.
So let's say, what kind of other pathologies, if someone's having pain in that area, could it be like a bone spur? And how would you differentiate those?
Sure. Yeah, so I take an x-ray, and there's one view on x-ray called the lateral view, which just looks at the side of your foot. And on that view, I can see if there's a massive cyst within the heel bone, the calcaneus. Sometimes that cyst you don't even know about, but it's causing some pain. Those are super rare, but it's something we need to evaluate for. Another thing is a stress fracture. Those are not uncommon in people who run a lot. And clinically, I squeeze the heel to see if they have pain, above the bottom of the foot. But on x-ray, you can also see a white line, which would indicate that they have a healing stress fracture. As far as the spur is concerned, unless they have an autoimmune disease such as rheumatoids, some kind of seronegative autoimmune disease, spurs do not correlate with their pain. And they've done a number of studies to show that a plantar heel spur, if it's not related to a seronegative disease, does not cause your symptoms. It's actually deeper to the plantar fascia, and it's coming off the flexor digitorum brevis muscle. So it has nothing to do with the pain you're experiencing. So a lot of patients come in, they think, they have this heel spur diagnosis, they're coming to me for a second opinion or whatnot, or they've read up on the internet, and I tell them, we leave the spur alone, we don't go in surgically and try to remove it. This is a soft tissue issue.
Cool.
Yeah.
All right, so our first question comes from, hope I'm saying this right, Olia. She said, how much do you charge for a checkup, and is it covered by insurance?
Sure, yeah. So we're on most insurance plans, pretty much all insurance plans. And if you don't have insurance, or you have a massive deductible, or if you're out of network, we do consults, initial consults $125, and then x-rays is another $25 on top of that. So very affordable, and then if you need an injection, I think that's around $80. That's the fee.
Cool.
And if we do like a stem cell injection, it could be a little pricier, but it just depends on what you're looking for.
Cool. The next question comes from Lachelle. They're asking any exercises to prevent shin splints. Do you do a lot with that in your clinic?
Okay, so it depends what type of shin splint. So you can have anterior shin splints, which comes across here, and that's usually if you're doing a lot of extending. So a lot of running uphill where you're really flexing your ankle joint, or you're going downhill and you're braking and really hitting on your heel. You can also get medial shin splints right along here, and that's coming down the posterior tibial muscle and goes into the arch of your foot. The medial shin splints I see mostly with people with flat feet. So they're standing, the arch is collapsing, they're putting a lot of strain on this muscle and tendon. So with either one, what I tell patients, you need to work out the trigger points. So this is just a muscular and fascial thing. So either go to a really good active release therapist or massage therapist who knows their fascial planes, who understands muscles, who can dial in, figure out where those trigger points are, dry needling, manual manipulation, all that works. So if you're dealing with shin splints, just go in and have the muscles worked. If you have a really flat foot and you're getting pain medially on the inside, arch support would eliminate that almost immediately, as well as some PT strengthening.
Awesome.
Yeah.
Okay. We had another question, because you mentioned toe yoga.
Okay.
Could you demonstrate what some of those toe yoga exercises would be?
Can the camera look at my foot?
It can. It can see.
Okay. I also have a bone model, but so toe yoga, I'll show you standing up. It's when your big toe comes up, so you're isolating the extensors to your big toe. You could also press it down to isolate the flexors, or you could even put something under the toe to really, cause some resistance. And then you bring your little toes up, and you can just go alternate back and forth. And that's just strengthening all the extensor muscles and the flexor muscles, and just getting your intrinsic muscles to work. So you have small muscles in your feet that just helps your toes function. Same things in your hands. That's why we can move our fingers around, because we're not in shoes all the time, casted. So,
yeah.
Does that make sense?
I think so.
Okay.
I like it.
Look up toe yoga online. I think you can find better demonstrations.
Cool.
Okay.
So if plantar fasciitis is one of the most common things, what are some of the other ones that are up there with that?
Yeah, Achilles tendinitis for sure. So the Achilles tendon back here, you can have insertional where it inserts into the bone, in which case you can have a very large spur. Those spurs are significant. That's not just some kind of incidental finding on x-ray. You have a large spur there where the Achilles is inserting, that can cause a lot of pain. And you can get calcifications in that area too, causing the tendon to be very painful. You can also get mid-substance Achilles tendinitis, which is further up. This area doesn't have great blood flow, so if you get a little tear, it can take a really long time to heal, or the tendon sheath itself can be inflamed. There's a lot of protocols to help with this. Eccentric heel lifts has been a thing for years. That's pretty much when you drop your heels down and come back up. The new literature is actually showing that concentric exercises are almost better, loaded. So that just means, standing, sometimes getting underneath the Smith bar and just going up on your toes, and doing reps where you actually hold the concentric exercise for 45 seconds. And do that 5 times. So that's new in the literature. And you don't even have to go all the way up on your toes. The first day you might only go like 25%, or then like 40%. think the literature states 40 to 70% of max range of motion. But those concentric exercises are great for
If you have any questions, feel free to chime in too.
I have a question.
Yes, sir.
Regarding that, I have that little pain that after a run bothers me. So it could be the Achilles or.
Oh, I can't see where it is.
It's
Over
just
there?
the last
back
part
there.
you mentioned.
It could be Achilles, it could be perineal tendons.
So that's the best exercise for recover.
Since you're here, can I evaluate you afterwards? Because it
Yeah.
could be, if it's right along the side here, it could be your perineal muscles. So sometimes it's hard to distinguish, you know, on this side, is it the post-tib or the flexor tendons that are bugging? On this side, it could be the perineal muscles that are bugging. So it's good to differentiate between that as well as the Achilles. But I can show you some concentric exercises.
Okay, great.
Yeah,
Thank you.
sure.
Awesome. We were talking about this a little bit before the video
Yeah.
about one of the things I'm dealing with when I run. And you gave some great advice that I think would be cool to share. So when I trail run, I often get a sharp pain in my metatarsal area or in the ball of the foot.
Yeah.
And it only hurts while I'm running, and so afterwards I forget about it until I'm out on a run again.
Yeah.
What would you imagine that is, and what would you do for that?
Yeah, so three most common things that I see in that area. Well, one could be a stress fracture. So, you know, press on the bones to make sure they're not hurting. Stress fractures kind of hurt all throughout the day. They're not just going to hurt just while you're running. And they'll typically get really bad while you're running. They don't just kind of warm up and get better. The next thing would be capsulitis. So the small joints in your forefoot, these guys here can get super inflamed. They're tiny. So if those get inflamed, you know, I evaluate for that and treat accordingly. And the third thing would be a neuroma. So the nerves that run between these metatarsal bones, they can get irritated if the metatarsal heads are shearing against them. And that kind of sounds what you're dealing with, John.
Yeah.
So it's pretty transient. It just comes about, you know, 7 miles into a run. And I see this problem occurring with people who wear tight shoes or even tight socks. So I know we love compressive socks, but sometimes socks are just enough to put some impingement on that nerve. And treatment for that, you know, wide toe box is awesome. You know, Ultra makes a great shoe, Topo. I've had a number of patients that just switched to an Ultra and they never have the pain again. It's phenomenal. Sometimes a metatarsal pad can help. I've had probably 50% success rate with that. It just takes, you know, the metatarsal heads and pushes them apart a little bit if you're putting something under here, and just decompresses the nerve. The third thing is a cortisone injection. I've had variable success with those. More success than not, and it also just depends on how large the nerve is. So if the nerve is greater than, I believe, half a centimeter, they typically don't respond super well to injections, but if they're just slightly irritated and enlarged, I can get patients through a full ski season in tight boots, or even indefinitely through their running career with just a simple injection.
Cool. I want to apologize to the people commenting on the video. I just didn't scroll down, so I thought no one was commenting, but we have a ton of questions now.
Fire away.
So are there any specific well, Gavin asked, are there any specific foot stretches he should be doing post-run?
Foot stretches, so be careful with foot stretches. You know, it's great to stretch out your calves if they're tight, your hamstring if they're tight, even your shin muscles if they're tight. I think the better thing is to think more about mobility. Like, are your joints moving well? Is your body moving well? You don't want to stretch your feet out a ton, because the muscles and soft tissue structures in the bottom of your feet, they're not very resilient, so they will tear. So fascia, for example, it's not like a muscle. A muscle, you stretch, the fibers tear and it heals in a longer position. Fascia, if it tears, it heals in like a fibrous knot. So you don't want to be cranking on your foot. I know there's a lot of popular yoga poses where you put your toes back and really stretch out the fascia. That works sometimes, but if you're having like plantar fascia pain, you don't want to be cranking on the bottom of your foot to stretch it out. So think about, stretching out tight muscles if need be, or working on mobility. So if a joint is tight, sometimes using an exercise band that helps distract the joint. And there's various videos online. Kelly Starrett, who's a big CrossFit guy, shows how to like stretch out your hip, your ankle joints. There's great exercises, but think more on mobility, rolling out your tissues to make sure that you don't have any knots that are causing tension. That's what I would focus on.
Cool. Kelly asked Every time I start running, I have a shooting pain up my ankle for a few minutes.
Okay.
But it only lasts for a few minutes, and after that it goes away, and she can go for hours afterward.
Yeah.
She said she doesn't get it. Any ideas?
It sounds like a tendonitis. Is it on the outside of the ankle? Okay, so assuming it's just like on the outside of the ankle, it just sounds like a tendonitis to me. It just warms up super quick. It could be, the tendon sheath gets a little sticky, and once you get it gliding and moving better, it's no longer painful. Another thing is distal pain, such as like tendinopathy back behind your ankle, could be manifesting from tight muscle knots. So you might have like a little knot in your muscles somewhere, and if you can work those out either by moving, such as running, or manual therapy, then you're not going to have the pain distally. But that sounds, I'm guessing perineal tendinitis if it's on the outside of your leg and it's so transient.
All right. So we also have, do you have a certain brand or kind of insert you like?
So inserts I prescribe sparingly. I don't make that many custom orthotics. I reserve those for like older patients who have really bad midfoot arthritis or really bad bunions that don't want surgery, or other pathology. But most runners, they have strong feet, they have healthy feet. They're not, unless they're totally collapsed in, I don't prescribe an orthotic. As far as over-the-counter orthotics, Sol makes a great one, Superfeet, Montreal. Those are the three go-to. They're usually around $50 for patients who don't want to pay more for a medical grade or even a custom orthotic. Custom's always best. I do 3D printed ones. They're phenomenal. I have a scanner, force plate. They're awesome, but they're indicated for certain things, and not everybody needs an orthotic. I'd rather everyone, wear proper shoes and strengthen their feet. And if you need an orthotic, those three, Sol, Montreal, Superfeet, they're good go-tos to see if they work.
Yeah. Along with that foot strengthening, there's always been this off and on in the running community about barefoot running.
Sure.
What do you think about that? Is that an effective way to help strengthen the foot?
Yeah.
Is it something that people should be trying to do more?
Yeah. So I think everyone should be walking around or running barefoot some of the time. So if you haven't run around barefoot your whole life, like, you really want to transition slowly. What I found when I first moved to Utah, I was all about vibrant five fingers, the New Balance Minimus, the even more minimalist Minimus, and I ended up with some stress fractures because the trails here are super rocky, and those rocks just stab into your feet. And talk about neuromas, capsulitis, stress fractures, like, you're just setting yourself up for that. I think if you're going to run barefoot or minimalist, go to a track. Go on the turf field, which is in like every single track around Utah. There's great tracks around here, and practice running barefoot or in minimal shoes. And maybe do like 10% if you're running initially, and maybe transition up to 20%. And even that alone is going to strengthen your feet. And then, like, if you have, like, I recently got a puppy, so at night we're going for walks. I'm barefoot, and it just helps, strengthen my feet while just walking. So maybe start walking barefoot and see if you can tolerate that, and then incorporate some running barefoot.
Awesome. Michelle Harrison asked, what is your opinion on compression socks to help with foot pain?
Compression socks to help with foot pain. I don't know if they directly correlate with foot pain. I think maybe if you have some trigger points like medial shin splints or tibialis anterior, the compression can sometimes help, but most of the time, I never prescribe them for foot pain. That's a tough question. I don't even know if there's good science behind that, to be honest with you.
All right, that's good to know.
Okay.
Lori asked, because we had talked a little bit about the Achilles tendinitis.
Yeah.
Let's say someone has it. Is it going to be harmful to keep running and training while you have it?
I say no. I have plenty of my runners continue to run through it. As someone who's had Achilles tendinitis myself, I've run through it for weeks, and it finally got better. The worst thing to do is just to stop, wear a walking boot, and not doing any running or walking for weeks. Because when you have an injured tendon, you want it to heal in a certain way, so that the collagen is a type 1 collagen. So your body naturally has type 1 collagen. That's healthy tissue. And when you get injured, you develop type 3, which is like a scar tissue collagen. if you just immobilize the injured tendon, you're just going to heal it with scar tissue. So the best thing to do when you have a tendonitis is to move. Because if you move, it's signaling your body to bring blood flow to the area and start healing the tendon normally. If you're running and your pain is like a 10 for like an hour, like don't run on it. But if you can run and it's like you can get through those first 8 minutes, and it could be like really painful those first 8 minutes, but then you get to the point where it's like, oh, it's only like a 2 or a 3, and you have to deal with that for a few weeks. I would always recommend just dealing with that because it's eventually going to get better. Like tendinopathies, they can take a long time to heal, and you don't want to lose 6 months of fitness waiting for it to heal. I would look into, deep tissue massage, fascial stuff. Sometimes an orthotic can help with that, just to alleviate it, and then start incorporating the concentric exercises. But taking time off completely is just, it's never a good idea. Yeah.
It's never fun either.
It's never fun.
No. So this one might be more of an opinion one.
Okay.
But Patty asked, are Hokas really all that? They seem to be a solution to everybody's foot issues, whatever it may be, but I wonder if they're just so cushy comfy, but are they really that great, and do they give the support needed?
Yeah.
Like, do you have an opinion on that?
I'm pretty sure they just did a study on this, or they've done a number of studies actually, comparing like Maxima shoes, like the New Balance Minimus, or not New Balance Minimus, like the Hoka shoes versus like minimal shoes or Barefoot. And they've shown that shock absorption isn't that much more significant in a super padded shoe, because your body kind of has to figure out, like, when you strike, how much force you should put in the ground. So having a ton of cushioning doesn't necessarily mean you're decreasing the forces. Hoka's unique because it has like a 4-foot rocker. So people have knee pain, people who heel strike, sometimes going through that rocker really helps with them. If they have arthritis, like patients who have really bad arthritis, I always recommend a Hoka too. Like if they have big toe arthritis, like something called hallux rigidus, where the big toe joint has arthritis, or midfoot, I think they could be effective. I personally don't love them. I think the stack height's kind of high, especially trail running. You're likely to roll your ankle. But that being said, that's my opinion. Like, patients love them. I know it's like rejuvenated a ton of people's running careers. So I don't think they're any better than any other shoe in the market. That's my opinion.
Cool. Sean asked a fun question. He said, should I be icing my feet post-run? And I guess we could take that 2 different ways. Like, should people be using it as a preventative way to prevent injuries? Is there use in that? Or what injuries would it be useful? Like, would you suggest icing?
Yeah, so there in ice baths, there's so much controversy behind ice baths, and like if you're ice bathing right after a workout, does it delay recovery? I think ice baths feel great. I think going into water post-run always feels good. And if you have some achiness, it's not going to hurt just to dip your feet in water. What ice does, it vasoconstricts your vessels. It means it tightens up your vessels. So you're in the cold water, everything's constricted, and then you take your foot out, and then all your vessels open up. So it's called hyperemia. And then a bunch of blood flows to that area, and then it helps your feet heal. So that's where ice comes into play. I think it feels great. If you have time to do it, I would recommend it to anyone. I wish I did it more.
Yeah, awesome. Shout out from Mia. She said, I think it is great that you are a runner and can relate to foot problems from this.
Thanks, Mia.
And then Brooke asked a cool question. She said, what can I do while large and pregnant to help with rebalancing weight? And another way I could see that going is, what kind of foot problems have you seen come from, like, along with pregnancy?
Yeah.
And what can people do if they want to stay active?
Yeah. Okay, rebalancing weight. So the thing that happens so I've never been pregnant, so I can't relate 100%, but from all my pregnant ladies who come in, typically all their ligaments get super loose. And so sometimes they notice their arch collapses, or they start developing more foot pain. During your pregnancy, an arch support would not be a bad idea. Everything's kind of collapsing, and if you can support it, all the better. So when you get back into running, you don't have this brand new foot, or new knees, or wherever else the ligaments get loose. What activities can you do? I would say you can still run. I'm no obstetrician, so I shouldn't be giving advice on pregnancy and exercise, but I know plenty of marathoners and athletes that train through pregnancy. So slow running, hiking is great. Hiking uphill, just do things that are safe. Biking, I don't know, it's kind of sketchy. or even just going to the gym, doing a ski erg, you know, rowing if that's possible, getting on an airdyne. There's so many things to do to maintain your fitness. I was recently listening to a podcast, I think it was a Rich Roll, and one of the guys on there said, like, your heart does not know what you're doing. So as long as you're exercising, your heart is getting blood, it's pumping, it thinks you're doing something. So whether that be running or biking, you can maintain your fitness through, you know, injury or pregnancy by just cross-training.
Cool. We only have a couple more minutes
Okay.
to answer a couple questions. But Troy asked a good one that we haven't breached yet.
Okay.
It says, what would you use for basic beginning bunion pain while running?
Okay, toe spacers. So correct toes are great. Ray, the podiatrist who designed them, they're fantastic. I've had so many patients who've loved them. They go through all your toes, and sometimes what you have to do, if you look these up, you'll see like how there's space between all your toes. Sometimes just removing the one little spacer between your fourth and fifth is super helpful, and then you can wear them in your running shoes. So I'd say, you know, get a wide toe box like an Ultra or a Topo, get toe spacers and run in them, and they're actually surprisingly comfortable.
Awesome. I think we have time for one more, and I saw one up here. Let me see if I can find it again. If anyone has any other questions, we're going to be wrapping up, so feel free to comment them now.
I have a question.
Yes.
So lately when I've been running, I've noticed that the bottoms of my feet ache.
Okay.
And it's even after I run, they'll ache. So I feel like, I read somewhere that as you get older, you lose a lot of your fatty pads on the bottom of your feet.
Sure.
And I'm just wondering, is there something you can do to counter that? Is that correct, or do I just need to do something different to strengthen the bottom of my feet?
Sure. So strengthening is always good. Is it just your forefoot?
Yeah, mainly my forefoot. And
Okay.
it doesn't feel like fascia, it just feels like the bottom of my foot aches.
Just
Yeah.
achy. Yeah, a metatarsal pad could be super useful. So that just sits behind the metatarsal heads and offloads them. Also, just rolling out your fascia. I mean, the fascia goes all the way up to the metatarsal phalangeal joints. So if the fascia is tight in your midfoot, that's going to be putting a lot of tension in your forefoot as well. Another thing is, what kind of shoe do you wear?
Like to run in?
Yeah.
I wear the Nike Vomero.
Okay, so
And it has a good metatarsal like air pad, which is one of the reasons why I've been wearing
It's
it.
been helping?
Because it actually transfers air as you go from your heel to your forefoot.
Okay.
It transfers some air to kind of what you said, like decompress the metatarsals as you roll onto them.
Sure. One thing to also try is just stretching out your calves. So if your calves are super tight and you don't have the ankle dorsiflexion that you need, so the ability to move your toes back to the front of your leg essentially, you're putting a lot of stress on your forefoot. It's like wearing a high heel all the time. Even like a Nike that has a 10 millimeter heel to toe drop, it's still putting a ton of stress on that forefoot. So maybe trying a lower drop shoe could help with that, just to kind of balance things out, or stretch your calves out tremendously. You're a muscular guy. It looks like you have some calf tension. So just getting a towel, holding for 5 minutes, or even just sitting in a deep squat and moving around, getting some mobility in your ankle could help tremendously. Same thing, getting that band around your ankle joint and really doing some joint distraction can help.
Okay.
Yeah.
Okay. All right. Last question. Before, like, Aaliyah, she had asked about like the insurance and stuff before.
Sure.
She said, before coming into you, is there any other resources or additional information she should look into about foot pain?
Yeah, check out my website. I wrote everything from scratch. There might be some typos, but I feel like I have pretty good info on there. It's www.finalkick, A is in Apple, F is in Frank, C is in cat.com. So finalkickafc.com. I pretty much talk about, I think I probably have 30 topics on there that I talk about. I have some videos, I have some blog posts. I feel like everyone can diagnose themselves based on my website. So, and if you can't, tell me so I can actually write a blog post about it.
Awesome.
Yeah.
Well, thank you so much
Thanks, John.
for coming today.
Yeah.
It was super fun to hear all
Cool.
your answers to the questions.
Hopefully I answered the
Yeah.
question.
And thanks to everyone who commented on Facebook. We'll be doing the drawing shortly after the video and commenting who won the free race giveaway. Also, a big thanks to Utah Run for letting us come here and be in their space
This
and
was great.
talk about it.
Yeah.
All right.